Most diabetics ask this question, whether they should restrict coffee and tea in their diet. This is a very common query that comes to all of us as doctors. The answer is no. They do not have to restrict coffee or tea because coffee or tea per se do not contain much calories. In fact, plain tea without milk and sugar or coffee without milk and sugar hardly has 10 calories. What adds to the calories is the milk and the sugar. The sugar, we say, is always a no-no for all diabetics because we know that sugar increases the blood sugar in a big way. When we take 1 spoon of sugar with the coffee or tea, we are adding 5 grams of sugar. This 5 grams of sugar contains 5 into 4, 20 calories. But most people don't stop with 1 spoon. They usually take 2 or 3 spoons. So that makes it maybe 40 or 60 calories. But it is not just the calories that are a problem for the blood sugar. It is what type of calorie are you putting in. When we add sugar, we are adding plain sugar, which causes fast absorption, and the sugar in the patient's blood will rise very fast. So that is why we don't want diabetics to take plain sugar. So let's remove the sugar from coffee and tea. Now let's look at the milk that people add. The milk contains about 30 or 40 calories depending on how much milk you're adding to the coffee or tea. People who take tea without sugar with very little milk, for example, just a spoon or 2 of milk, are not increasing their caloric content and nothing will go wrong with their blood sugar just because they had tea with milk. People who take coffee, it depends on the amount of milk that is added to the coffee. So suppose they are adding a lot of milk to the coffee, then the caloric content of the coffee will go up, right? But it still doesn't matter because it is not much and it will not cause the blood sugar to rise very fast. So 40 or 50 calorie doesn't matter at all. The point is most Indians are sweet-tongued. We love sweets. Sugar is part of our culture. For every function and festival, our tongues are used to sugar. So most people cannot drink their milk, their tea or coffee without sugar. When this happens, then it's a problem. We advise most of our diabetic patients to take their tea or coffee without sugar, or they can take it along with one of the non-sugar sweeteners which are available in the market. So we educate our patients with diabetes to take their coffee and tea without sugar. Sugar is a habit. We are all used to sweets. That's why we want sugar in our tea and coffee. So if sugar is avoided, the number of calories in the tea and coffee comes down and it will not cause a rise in blood sugar in the patient. It is our tongue that is asking for sugar. Most people abroad have their beverages without sugar and they don't find it anything wrong. So it's a question of getting used to it. So what we suggest is slowly get used to not having any sugar or even a sweetener with coffee or tea, and any number of cups are easily allowed.